At the time, I didn't even think it was affecting me, other than it took the pain away. And then, I thought I was just living just fine. But according to people around me, that wasn't the case.
Opiates are prescription medications used to treat acute and chronic pain. They are controlled substances by the DEA because of their highly addictive nature. They are very effective with short-term usage. However, with chronic usage over time, patients can develop tolerance to these medicines and also dependence to them. Patients that are on 50 morphine equivalents a day are about 4 times more likely to have an accidental overdose death than those on low dosages.
The doctor would increase it so that it didn't hurt. And eventually, it got to the point where I was taking 100 milligrams twice a day of morphine.
There can be withdrawal symptoms by decreasing that dosage, not because of addiction, but because of dependence, physical dependence on these medications. So as we lower the dosage, people may experience more pain, but it's likely that that will be temporary.
At first, it was not easy because I had the fear of, I'm going to hurt, there's going to be pain. You've gotten so used to the amount of drug that you're taking that your body is fooling you, saying you need that amount, when in reality you don't.
Locally, regionally, we're still not immune to the opioid epidemic. We know that in Oregon there are more accidental overdose deaths than there are deaths from motor vehicle accidents. And these are our neighbors, these are people in our communities that are at risk and that are still dying.
There's a great possibility that you're going to lose your life. You want to get off of this as soon as you can. After a while, you get to the point where you're almost off of it and things start to blossom again. It's like walking in a rose garden when the roses start opening up. The blooms are beautiful, and you start to notice that. But it took almost a year for me to get completely off of the morphine. It wasn't just me. Had it not been for the support group, I don't think I'd been able to do it.
I think it's really important that as a medical community, we just continue to have conversations with patients, continue to raise awareness about the risks that are associated with these medications, and continue to strive to find alternative treatments that might be used to replace opiate therapy. I think ultimately, when we work together as a healthcare community, we can develop more effective and safer treatments for our patients with chronic pain.